Introduction. Zonisamide, ZNS, a newer generation anti-seizure medication ASM has been used in both human and veterinary medicine to treat epilepsy. Synthesized in 1979, ZNS has been available for human use in Japan since 1989 and later in the United States and Europe. It is recognized for its broad spectrum of activity with multiple mechanisms of action, including the inhibition of sustained, repetitive neuronal firing through blockade of voltage-gated sodium and T-type calcium channels, enhancement of GABA receptor function, inhibition of glutamate release, and protection of neurons by scavenging free radicals. These properties make ZNS an excitation-inhibiting ASM. In veterinary medicine, ZNS has favorable pharmacokinetic properties, with steady-state concentrations reached in 5 to 7 days and maintained with 12-hour dosing. Although used commonly in Japan since its potential efficacy was first described in 1996, ZNS is not yet approved for use in dogs or cats in the US or Europe, typically being employed as a second or third-line treatment option. Background. Previous studies on ZNS have shown its efficacy as an add-on treatment for drug-resistant idiopathic epilepsy, i.e. in dogs, as well as its potential as a monotherapy. Common side effects reported include ataxia, sedation, vomiting, and decreased appetite, which are usually mild and transient. However, there are also rare cases of serious side effects such as acute or chronic hepatopathy, erythema multiforme, keratoconjunctivitis, renal tubular acidosis, urinary calculi, and aggressive behavior. Objectives. The primary objective of the study was to evaluate the anti-seizure efficacy and tolerability of ZNS monotherapy in dogs with newly diagnosed IE. The study also aimed to determine the appropriate dosage and therapeutic range for ZNS when used as monotherapy in this population. Materials and methods. Study design and ethics. This study was a prospective, multicenter, open-label, uncontrolled trial conducted according to the Guidelines for Good Clinical Practice, GCP, for veterinary medical products in Japan. Informed consent was obtained from all dog owners, and the study complied with GCP approved by the Japanese Ministry of Agriculture, Forestry and Fisheries. Case selection. Client-owned dogs with newly diagnosed IE were recruited from 18 institutions in Japan between 2009 and 2012. To be eligible, dogs had to be ASM naive and have experienced at least 2 epileptic seizures within the 12 weeks before the study. IE was diagnosed based on a minimum TI confidence level as described by the International Veterinary Epilepsy Task Force, IVETF. Dogs younger than 1 year or older than 6 years underwent additional diagnostic procedures, such as bile acid testing, MRI, and cerebrospinal fluid analysis. Study protocol. The study consisted of a 4 to 12-week baseline period, a dose titration period, and a 12-week evaluation period. ZNS was administered orally at an initial dose of 2.5 to 6.25 mg/kg every 12 hours. Dosage adjustments were made based on seizure frequency, severity, and plasma ZNS concentrations, up to a maximum of 15 mg/kg every 12 hours. Trough plasma ZNS concentrations were measured using high-performance liquid chromatography at various points throughout the study. Efficacy and tolerability. Primary efficacy endpoints included changes in seizure frequency and seizure-free rates. Seizure severity was also assessed based on the duration of seizure episodes, the number of cluster seizures, and the occurrence of status epilepticus. Tolerability was evaluated based on owner diaries documenting medication administration, appetite, activity level, vomiting, abnormal stools, and any adverse events. Physical and neurologic examinations, as well as laboratory tests, CBC, serum biochemistry, and urinalysis, were performed at enrollment and at the end of the study. Statistical analyses. Data were analyzed using Minitab version 16. Non-parametric methods were employed due to the small sample size and non-normal distribution of data. The Wilcoxon-signed rank test was used to compare seizure frequency, duration, and severity between the baseline and evaluation periods. The Kruskal-Wallis test compared seizure frequency reduction rates among different seizure types. Laboratory results were compared using a paired t-test. Results. Demographics and clinical data. 56 dogs were enrolled in the study, with a nearly equal distribution of males and females. The study's primary findings include, efficacy. Of the 53 dogs assessed for efficacy, 76% experienced a 50% reduction in seizure frequency, and 55% achieved seizure freedom. The mean ZNS dose for dogs with a 50% reduction in seizure frequency was 4.8 mg/kg every 12 hours. Tolerability. Adverse events were observed in 13% of dogs, including reduced activity, decreased appetite, vomiting, hind limb weakness, soft stools, or constipation, which were mild and temporary. No significant changes were observed in laboratory tests. Discussion. The study demonstrated that ZNS monotherapy is effective and well tolerated in dogs with newly diagnosed IE. The findings support the use of ZNS as a viable treatment option, providing valuable information on appropriate dosages and therapeutic ranges. The study's open-label, uncontrolled design is a limitation, but the results are promising for future controlled trials.